Let's return to our top story. The Gauteng Health MEC has confirmed that ongoing water supply problems are having a significant impact on 16 hospitals in the province. In response to a question from the DA's Jack Bloom, MEC Nomantun Komoralehoko confirmed that 392 operations had to be postponed this year at those institutions due to water problems. And I'm joined now by the spokesperson for Gauteng Health Motalatale Modiba. Mr. Modiba, thank you so much for joining us. Is the department satisfied with the service provided by Rand Water?
Sally, I'm not sure if you're able to hear me from your side, but I think from the department side, we have been on a record several times, obviously indicating that indeed when we do have supply interruptions that tend to be prolonged, it does obviously impact on us as a department. Even though we do have contingency measures in place, sometimes those measures are not necessarily sufficient. Because remember that our measures allow us to be able to operate for about 48 hours if there is some form of interruption. But when the interruptions become prolonged, it becomes a bit of a challenge. We have been looking into that in terms of trying to improve the capacity within our facilities. You'd recall that earlier we did indicate some of the measures. If you look at hospitals like Helen Joseph, where they currently have a reservoir capacity of about 260,000 liters, we have already identified a space where we're going to erect what you call a 1 million liters capacity in terms of a new reservoir there. They do have a borehole on site, but the yield of that particular borehole is too small. I mean, it's about 8,000 liters of water per hour intermittently. We've got facilities like Pulusong, where we are currently finishing the construction of an additional 500,000 liter capacity. Now, those would be some of the interventions that we're making at some of the other facilities, but that is not to say that if you've got those, then automatically your problems go away. Because remember that you always need to have supply from the source. If you have those interventions in place, but there's a problem at the source, then your next challenge would be, how do I draw the supply from the source to get to the facility, as we've seen in the recent past. But the good thing is that we are not working in isolation. We are constantly engaging with the water utilities and with the municipalities to look at various other ways in which we could improve services and lessen the interruptions. And I know we're probably going to go into the issue around the backlogs in terms of how we deal with those particular backlogs. We also
All right, so let me just jump in here. We do have a slightly shaky line. I can hear you clearly. I'm not sure if you can hear me, but I am just going to repeat my first question. Okay, you're back. All right, so what I asked you, which you haven't answered, though you have explained very well what the department is trying to do to make sure there's backup water. Of course, that doesn't help you if there's no supply for 7 days. It is a very tricky situation. Is the Department of Health satisfied with Rand Water's service?
Look, the issue of being satisfied with services, I suppose that at this stage, it's something that is continuously looking at evaluating to improve the service.
So sorry to jump in. Is that a no? Does that mean no? You're actually not happy?
The same way people.
Sorry, is that a no then? That you're not currently satisfied with their service?
So there are areas where the service is excellent and we don't have any issues, but the supply issues are persistent.
All right. I think we're going to have to leave it here because, unfortunately, the line is disintegrating as we speak. But certainly what we've got from the Gauteng Health Department spokesperson, Motalatale Modiba, is that there are times when the service from Rand Water is good, but there are times when they're let down. And, of course, we are judged by when things go wrong and how we deal with them. Mr. Modiba, I'm just going to try one last time to see if this line is clear. We are really battling with it. But just to summarise what you're saying is that it's sort of yes and no is your answer to my question, because there are areas where Rand Water is not doing what it should. So we are seeing calls today for the Rand Water CEO, for example, to be fired. Would you support that or not?
I don't think it's a call that we're in a position to make. Remember that, Sally, that we ourselves, as health, Department of Health, we render services ourselves, and consistently, even ourselves, we are consistently being evaluated in terms of the quality of service we render. And I think it's important that we introspect in ourselves in terms of to what extent are we improving our own services and so forth. So I don't think it's a call that we are in a position to can be able to
Look, I think it is
make
actually,
support
and
or
let
not
me
to support.
explain why, because
It's
I
not
understand
in
what
our
you're
space
saying.
to actually,
Let me just jump in here. Let me just jump in here. Sorry, I know our line's awful, but I understand that there are infrastructure challenges within hospitals. From what I'm hearing, the department is trying to improve capacity for water storage. There's also issues of when the water is available. You know, if you have to pump it from a reservoir on site, it might be difficult to pump it to the second and third floors, for example. So I'm aware that the department is trying to sort that out. But I want to know about the supply of water from Rand Water, because I'm trying to get an understanding from someone that they service that literally has lives in their hands, where you've had to postpone operations, whether you, and I do believe that you have the right to say, look, we don't think the CEO is doing a good job, or we do think he's doing a good job in difficult circumstances. Does the health department not have a view?
Look, again, it's a very a bit of a difficult one for us in the sense that I don't think it's our space to actually cast a view on that. All that we know is that we've got relationships with all water utilities, including the municipalities, and we're consistently engaging with the utilities to improve relations, to find better ways to service our various hospitals and clinics in terms of ensuring that there's stability of supply there. So we are consistently working on those relations just to ensure that we work closely with the various utilities to help us so that because the solution is, in as much as, yes, it's the primary focus in terms of supplying water, it's important that as well we come in to also offer ideas here and there. And we've been working closely with the colleagues in terms of the utilities and the municipalities. Yes, we do have challenges in certain areas where you find that the lack of supply or the poor supply or the inconsistent supply affects services. But at the heart of it is the various entities being able to work collaboratively to explore various solutions that could be meted out to ensure that we minimize the impact as much as possible.
All right, and I hear that you're trying to negotiate better services from Rand Water, but 392 operations had to be postponed this year purely because of water supply issues. I mean, never mind like the electricity problems and all the other issues that are faced by hospitals, just because of water supply. Is it going to be different next year or not?
I don't know whether it's going to be different next year or not. But what I do know, Sally, is that from the department side, we do have, you would know that during Mandela Day, we announced a program of surgical marathons where we are attending to the various backlogs that we have. In June, I think we were sitting at around 37,000 surgical backlogs. We're now at around 18,000. We've been able to cut that backlog to around 18,000, and we're working. The target is that we do at least a minimum of about 8,000 operations a month, and that's part of a consistent program that we did announce to say we're declaring war on surgical backlogs to ensure that even where we do sometimes have disruptions that sometimes have nothing to do with water supply, they've got other sometimes a challenge that has got to do with other areas within our operational environment, we then are able to catch up insofar as that particular area is concerned. And so far, there's been some positives in terms of that particular function, because what we've seen, we've been able to build up capacity, increase capacity within our health facilities. You have seen recently facilities like Begimlangeni, Sebokeng Hospital that in the past were not doing certain type of operations, but now because of this increasing of capacity, they are able to at least enter and do those particular capacities. And I think we are gracious
All right.
enough to also admit that ourselves as the health department, we do have our own challenges that we're actually working at addressing. And I think that's where our focus is, to ensure that ultimately we're able to offer an improved service to the millions of people that
Okay.
depend on the public healthcare system.
All right, thank you for speaking to us this evening. That's the spokesperson for Gauteng Health Motalatale Modiba. And apologise, we did have a really difficult line that came and went throughout that interview.